Hello everyone and a warm welcome to this special webinar. Today we have an incredible guest with us, Dr. Rani Gupta ma'am. Dr. Rani Gupta, a distinguished Ayurveda specialist and consultant with over 15 years of experience in the field, a gold medalist in her MD from Institute of Medical Science at BHU Varanasi, BMS from Lucknow University. She has brought smiles to people's life for treating problems related to endometriosis, infertility, fibroids, and PCOD. Women with Wings is indeed fortunate to have you, ma'am. Over to you, ma'am.
Good afternoon, dear ladies. I hope I am audible to all.
You're audible.
Yeah. Today the topic is healing endometriosis with Ayurveda. I know all of them who have registered might have their own journey of dealing with endometriosis. So I also have a small journey to share with you about healing of endometriosis. So how my journey started with it. Back in 2006, when I completed my MD, so that was in 2006, and endometriosis was not that prevalent at that time. And so just after finishing my post-graduation, I started with the practice. And within a few months of my practice, I got my first patient of endometriosis. She was an ophthalmologist, doctor, and she was very much suffering with endometriotic symptoms, severe pelvic pain, and she could not take painkillers because of her some medical reasons. And she was very much into the suffering. So at that time, I had no idea about how to, treat endometriosis with Ayurvedic principles. I started fishing into my Ayurvedic text. I started navigating into the text, understanding the principles, and then I started her treatment with some medicines, Ayurvedic medicines, according to her doshas, according to her body type. And I did Basti treatment, which is a kind of Panchakarma treatment for her. We did 16 Vastis, medicated enema for her for regular 16 days. And that is how the treatment was continued for 3 months. And then she left. I also forgot and started with my practice. After almost a year and a half, she came back in the clinic. I know one day she was there and she thanked me enough, and she told me that since she took the treatment with Vasti and medicines for 3 months, now it's being 1.5 years and she is completely fine and painless. So that was something which is like an eye opener for me, that even if the name of endometriosis is not being mentioned in our Ayurvedic text, if we very well connect it with the Ayurvedic principles, we can definitely help treat the patients effectively. And then I started researching on it, then did hundreds of patients by now. And then now I know that with Ayurvedic treatments, without any painkillers, without any hormonal pills, without any surgical methods, we can very well handle endometriosis with Ayurveda. So coming to what is endometriosis. So endometriosis is a systemic inflammatory disease. As previously understood, that it is a gynecological disorder or a endometrial-like tissue goes upwards, goes through the fallopian tubes and spreads into the pelvis. It's not like that. It's basically, there are certain changes in the body on the level of autoimmunity, on the level of inflammatory changes, or according to Ayurvedic principles, according to some doshic changes, there are certain lesions similar to endometrium, but they behave differently and they act differently. And that is how the symptoms of endometriosis could be found in the whole body. There are certain facts which most of us know, but I think we need to emphasize them. to get more aware of this disease. It is one of the 20 most painful diseases a human body can go through. And we know that the incidence is so high that 1 in 10 women suffer with endometriosis. It's a whole body disease. It can be found in each and every organ of the body. And it causes severe symptoms, which may not be gynecological symptoms and can be present throughout the body. And pregnancy, menopause, hysterectomy are not the complete cure of endometriosis. So there is one thing I would like to emphasize most on when we are talking about endometriosis is that it takes 8 to 10 years to diagnose endometriosis. And not just in India, it's a data which is being taken on the global basis. So why is it so? Why it is like in such an advanced era where everything could be diagnosed in a click of a second? Then why it takes so much time to diagnose endometriosis? Why there are so many delays in getting the diagnosis of endometriosis? This is really important to understand because this delay is the major reason why the patients of endometriosis suffer that much. Because as we delay the diagnosis, the complications starts increasing, the adhesions in the tissues starts increasing, and a patient reached at a certain point where the reversal becomes really difficult. So I think early diagnosis is the key to get a real treatment for the endometriosis. So according to me, what I can understand, there are certain reasons why diagnosis is being delayed for endometriosis. The first symptom is that we ignore the initial symptoms like period pain. There is enough gaslighting in the hospitals or by the general doctors or even sometimes by the gynecologist. If a young girl is taken to a doctor regarding the period pain, the first thing that comes up in the mind, okay, so common, koi baat nahi, manage karo, hota hai. Painkillers kha lo, theek ho jayega, sikai kar lo, theek ho jayega. Common hai, it's natural, it's physiological. So these are certain things which are, according to me, is a pure gaslighting. It's nothing like that. A period which is absolutely normal should not give you that much of pain while during the menstruation. Second thing which causes delay in the diagnosis are the overlapping pathologies. So irritable bowel syndrome, interstitial cystitis, sciatica, low back pain. These are some of the common symptoms of endometriosis. And these are usually, not diagnosed in connection with the endometriosis and are being treated separately for many years. And then after the doctor realized that, oh, it's not IBS, it's not something related to your bladder, overactive bladder, it is not sciatica. Then they, get to understand that these are the lesions of endometriosis, which are there on different organs leading to these pathologies. The diagnostic methods are also limited. So sometimes even ultrasound and MRI could not see the lesions of endometriosis. Pelvic examination is not enough to diagnose. Pap smear is not enough. So, and then laparoscopy, it's not that easy. Like for a young girl or for a young married lady, you cannot immediately, guide them to undergo laparoscopy for that cases. And even negative ultrasound or MRI report does not exclude the presence of disease. So that is also one of the reasons that if you undergo ultrasound or MRI and the report comes negative, that means it comes normal. You think that, oh, then it's okay, I have no endometriosis. It's not like that. It can easily skip the findings of endometriosis. And last but not least, a very important concept of menstrual appropriate behavior in the modern world. So what is menstrual appropriate behavior? In a newer world, in a modern world, there is no such concept. We are being fed with a newer understanding that we girls or we females or we ladies are very much like males. We can compete with them. We can run, skip, jump during our periods. We should not take rest during our periods because we are not lesser than the men. But we need to understand that we are not lesser, but we have our own physiology. During the menstrual phase, our body has a high vata. And to balance that high vata, which is there, we need to give ourselves some rest mentally and physically during those days. So just an understanding of, having a sattvic food, light food, warm food during those days. If you are going for a heavy gymming or exercising, you should skip those exercises during those days. You should not be hurried in anything. If you can, postpone something important, you can definitely do that, because you should feel special about it. And like if you ask your grandparents, if you ask your dadi nani, they would have told you that they were being given a chutti from their kitchen, from their mandir, from everywhere in those days. That was not a taboo. That was a way of giving them rest during those days, which is really important. In my practice, I have seen many cases. Very recently in my OPD, there was a young girl of 13 years with a big sized cyst, endometriotic cyst, that was really worrisome because she was so young. And after taking the elaborate history, I could figure out that she was doing skipping while she was on her periods, which is absolutely against the principles of Ayurveda, because some vigorous exercises can definitely lead to vata imbalance or vata aggravation during that time. So, this menstrual appropriate behavior is something we need to discuss more. Maybe we can do another whole lecture on this topic. It's so big topic, but I would just like to touch this because this is important for you to understand. So periods are not meant to be extremely painful, heavy, debilitating, or life-altering. And so this verse I have quoted here because it is from Charak Samhita, which is a 5,000 years old text of Ayurveda, written by Maharshi Charak, who is the father of Ayurveda. And here he describes the features of proper menstruation. So this verse is in Sanskrit, and here I have elaborated it, that an ideal period should come once in a month. It should not be associated with pain. See, so he is describing the period being painless as normal. So why over this much of years we have come to the conclusion that periods, if it's fine if you are getting so much of pain during periods. So the duration of bleeding should be like approximately 5 days, not more, not less. Even the color, the quality, the texture of the menstruation is being described. See the progressive nature of Ayurvedic science, that even at that time, every small detail of the menstrual blood was being described as being normal or abnormal. Period pain can be common because most of the time we are not following the way we should follow the diet, lifestyle, and so many things regarding periods, but it is not normal. We should not neglect the initial symptoms of period pain because we know that if we ignore this, after a few years or few months, the disease can spread. And then at a certain stage, it is difficult to reverse the disease. The main 6 Ds are the symptoms of endometriosis. There are so many other systemic or the whole body symptoms also present, which are individualistic to different patients. But these are the ones which we find very commonly in the cases of endometriosis. The first is dysmenorrhea, which is period pain. There are some disorders of menstruation, like some people, they bleed heavily. Some have irregular bleeding, some have scanty flow, some have spotting in between the periods, some passes big clots during the menstruation. Dyspareunia is a difficulty in sexual contact. Dyschezia is difficulty in passing stool. Dysuria is difficulty in passing urine. These 2 symptoms happen when we have some lesions of endometriosis present on the intestine and on the urinary bladder. And dull ache of abdomen, which is a chronic pelvic pain condition. Causes of endometriosis, when we talk about the causes, exact cause is not known, but there are some predisposing factors or incidences we have seen in our general practice that I have tried to, point out here. First is that the incidence of endometriosis is high in urban class. In females or ladies who are over anxious, who are career oriented, who are more perfectionist. It is not so common in rural women. Why is it so? Because obviously we all urban ladies, we have our 6 or 10 hands together. We are doing a lot of multitasking, managing the family, managing the house, managing the work, and a lot of other things. So because of that nature, excessive of stress buildups, again causing an imbalance of vata. Because of this quality of ours, we are not eating the food on right time sometimes. We, have so many things to do that we are eating while we are on the laptop, or, so many ideal regimes which we should follow regarding our diet and lifestyle are not being followed because of us being super busy in our lives. And there is one more point here which is very important according to Ayurvedic principles, is our tendency of Vegdharan. Vegdharan means suppression of urges. What does it mean? It means that right now, if I'm in a meeting and I want to go for a pee, I cannot because I'm in a meeting. So I'll hold it for maybe an hour or 2 hours. So that is something which in Ayurveda is quoted as a very important reason for Vata imbalance. So it is just an example. It can be a urge of passing motion, passing urine, urge of sneezing, even the urge of being being thirsty or being hungry. If I'm holding my urge to eat something for many hours, that also leads to Vata imbalance. So slowly, if it becomes a habit of ours to hold our urges, there are 13 urges. So again, it can be a separate topic of discussion if I want to elaborate about that. But this is really something which leads to Vata imbalance in the body. Second point is diet, leading to dosha imbalances. Here, I would like to emphasize that Ayurveda is a science which is never one size fits all. So even the diet is not something which we can figure out for all endometriosis patients. According to your body type, according to your prakriti, according to the symptoms of endometriosis you have, the diet which is good for you can vary a little. So according to your dosha imbalances, the diet should be there, and your gut or your digestion should remain good. That is really important. We will discuss it later in the later slides. Negligence of menstrual regime, as we discussed, the menstrual appropriate behavior is often neglected. That is one of the major causes of endometriosis. And excessive usage of hormones or oral contraceptive pills for regularity of periods, or sometimes when the periods are being stopped for many years because the female could not manage with the pain. So this is one conventional method of managing the symptoms of endometriosis, which further leads to imbalances. So it is basically just to manage the symptoms, but it has nothing to do with the treatment or the healing. So if taken for a long time, it can also lead to further imbalances. So I believe that for the diagnosis of endometriosis, there is one key rule. If a young patient with menstrual and gastrointestinal, that means digestive symptoms, and chronic debilitating pelvic pain is presenting at our clinic, and all of her tests have been negative, so she is not even found with any kind of endometriotic cyst, she should be considered as a case of endometriosis until proved otherwise. It is easy for us to think that way because we are not going to give her any hormones or any such medicines which will be causing a lot of side effects if she was not an endometriotic patient. We are just going to give her some detoxification panchkarma. We are going to balance her doshas. So in any case, we'll be going to, mold her towards her healing process. So this is a key rule for the diagnosis of endometriosis. So how we approach endometriosis with Ayurveda? First is that we have to follow Ayurvedic principles. With the modern diagnostic methods and with all the modern pathology, we never treat a patient. We have to see her dosha type, her all the Ayurvedic things with elaborate history taking, and then we understand the case with Ayurvedic perspective and treat the case. Early diagnosis and intervention is required. In early cases, it can be effectively reversed completely, and in later cases, it can be effectively managed by using Ayurvedic medication and Panchkarma. So these are some Ayurvedic treatment guidelines which we follow. First is Aam Pachan. I'll elaborate it shortly after a few slides. Restoring Agni or managing digestion. Third is Vatanulomana. I will elaborate it. Dosha balance, Panchakarma, Rasayan and Vajikaran. These are the fewer steps which we follow in the Ayurvedic treatment while treating a case of endometriosis. So Aam Pachan. Aam is, so you may understand it with the concept of inflammatory toxin. It is something which is produced in our intestines when the food is not digested properly, when the food is not taken properly, when the food is not taken the right time, when the food is not appropriate for your body type. So by any which ways, if the food is not digested, that undigested food which remains in our body is converted into some inflammatory toxin, which is called ama. We very well understand that while we treat endometriosis, we go for a lot of markers, inflammatory markers like CA125, and we find them high. So Ayurveda believes that this ama, which is formed in the intestine, it spreads into the whole body, obstructs the flow of vata and the other doshas, and leads to a lot of inflammatory disorders, out of which one is endometriosis. So with the correction of diet, and that is why you might have seen many stories, that I have cured myself with a good diet. So many of the times it happens because they, by skipping so many of the things from their diet, they regulate their digestion, they stop forming ama, the flow of vata starts to flow again properly in a right direction, and slowly the pathology is being reversed. So that is how correction with diet is very much true in case of endometriosis. So Am is like an inflammatory marker, and we know that endometriosis is also associated with elevated inflammatory markers. So if gut or our intestine is not able to eliminate these toxins, it spreads into the whole body and can cause many inflammatory diseases, including endometriosis. Vata Anulomana means Vata, we know, I have said so many times in this lecture, is a kind of dosha which is responsible for so many movements in the body. It is also responsible for the proper menstruation with a regular flow, with a regular amount, with a regular, without pain, out of our body. So a proper direction of vata is required for having a proper menstruation, right? So if that vata is not flowing in the right direction, in a downward direction, it often leads to painful periods, obstructed periods, or irregular periods. So we need to correct the vata channelization. We can do it by a good diet. We can do it with some medication, and we can also do it with various panchkarma procedures, which is a very important part of Ayurvedic treatment. So here comes the Basti treatment. Basti treatment is a superhero treatment for endometriosis. Because when I treat endometriosis at my clinic, it is one treatment which I prescribe to all the endometriosis patients. And many of the times when they are new to Ayurveda, they are confused that how come a disease which seems like a gynecological disease, we give them some enemas. So Vasti is basically an Ayurvedic enema method, which is given through the rectum into the intestines. The purpose is not just to clean intestines. The purpose is that it gets absorbed into the intestine and then starts balancing the vata in the body. So that is how it works in the endometriosis treatment. And it is really a very effective treatment method in the case of endometriosis. If it is done properly, if it is done with the right kind of medicines which are used, because it is not just with water or any kind of oil we can do the enema in endometriosis. It has to be specific for the treatment of endometriosis. So why Vasti is given in endometriosis? One is, we already have discussed that the vata flows unobstructed in the right direction when a Vasti is given for a particular period of time. Dysfunction of vata is responsible for painful, irregular periods and even infertility. So by doing Vasti, we can maintain the proper function of vata. And we understand that colon or large intestine is the seat of vata. And from there only it controls various body functions. So if we are giving a Vasti in the colon or large intestine, we are very much balancing vata in our body. In Ayurveda, not just in endometriosis, in a lot of disorders, right from the migraine to the joints pain to the sciatica, so many disorders we do Vasti, because from there we balance vata in the body, which is a very important dosha responsible for many imbalances in the body. And if we understand this Vasti in endometriosis in a modern perspective, here is the reason why we do Vasti. First is that there is a gut-brain axis. So our intestines and brains are connected with a signaling method. And if the GIT is functioning normally, if the intestine is functioning good, if our digestion is good, then the gut health can actually affect a lot of body functions via central nervous system. And the second and very directly connected understanding is that the gut microflora, that means the various microorganisms present in the intestine, regulates estrogen levels in the body. And if the gut flora is not maintained, it can lead to increased circulatory estrogens, which is a hormone responsible for abnormal endometrial tissue growth and cyst is increased. So that is why doing Vasti and maintaining a right gut microflora can lead to improvement in the cases of endometriosis. And sometimes, according to the doshas, according to the prakriti of the patient, some other panchkarma methods can also help with the cases. For example, if endometriosis patient is also having some infertility issues, we do Uttar Vasti, which is a kind of Vasti given through the uterus, given in the uterine cavity. So that is how some other panchkarma methods can also be done. It is not so easy to elaborate it over here because it will be a big topic. And panchkarma is a kind of detoxification. So, and Vasti is a kind of panchkarma. So it is not just a treatment option for endometriosis. You will be amazed to know that when we do Vasti in our cases of endometriosis, they come up with a lot of side effects of Vasti. So side effects are usually all positive side effects. They say that, okay, I was having hair fall and I see a major improvement in it. My teeth are more white after getting Vasti done. I feel I have a better digestion. I sleep better after taking Vasti. So basically, the whole body undergoes detoxification. So not just the endometriosis gets better, but you get a lot of long-lasting health benefits with Vasti. But one thing which is very important is that you cannot do any treatment just as a regular protocol for all the endometriosis patients, because Ayurveda treatments are always customized and tailored. They work differently for different patients. And now it's the end part of the thing. So I will just touch a few things regarding the diet, because as soon as a girl is diagnosed with endometriosis, they start navigating in the internet. And the first thing they get is about avoiding gluten, avoiding lactose, avoiding sugar. So it is good to do that, but you should have an understanding of why and how you should do it. It is endo diet is not just avoiding gluten, lactose, and sugar. If you're going gluten free, you will go to the supermarket and buy so many things which may be even highly processed. And because of using of synthetic preservatives, additives, it can be even highly inflammatory. So, gluten thing is something where if you are doing it using a gluten in the form of bakery or processed food, or like in the form of refined flour, maida, yeast, bakery, then it might be bad for you, but you should be vigilant about if you are skipping the regular meal of your dairy or gluten, then what exactly are the things you should switch to? So if you are switching your regular milk to a milk like, rice bran milk or almond milk or soya milk, then, sometimes it can be even more harmful because of its processing, because of its additives, because of its, different things which are being added to it. So be mindful of what you eat and make informed choices. Here I have collected some cases of mine, a few cases which I treated with Ayurveda. So this was one girl of 34 years. She was married for 5 years. She came with severe pain and heavy bleeding, vomiting and fever during her periods, and she could not get up the bed for 3 days. And it was a telephonic consultation from some other state. She already had 2 laparoscopic surgeries in 2017 and 20, and then she was following it by 6 injections, leupride injections. And again, after taking all these treatments, she was found with a cyst size of 4.8 into 4.2 centimeter cyst and 3.6 into 4 centimeter cyst. So she was given a proper Ayurvedic treatment with medicines. She visited Delhi and she took Basti treatment. And in her next period, which came in July 21, it was 60% pain less with normal bleeding, no fever and vomiting. And then when she came here, we did Panchkarma, Yog Vasti, Uttar Vasti for her. And in the repeated ultrasound after a few months, 3 or 4 months, there was one small size cyst left, which was only 2.1 into 1.5 centimeters. So this was her ultrasound after the treatment. There was second case of a female 35 years, married for 7 years. She was again with the same complaint of dysmenorrhea, pelvic pain, with severe constipation. After she undergone cholecystectomy also. She had 3 surgeries, 2014, 15 and 2020. And she then got Mirena done. But even with that, she was not having relief. So it was being removed. And then she was given Ayurvedic treatment. She was given Yoga Vasti. And in her case, like the first ultrasound was 12th of Jan 22, and the second was 28th April 22. And you can see in the second ultrasound, as compared to the previous, right ovarian cyst has completely resolved. And symptomatically also, she was completely fine. I'm still in touch and she is completely fine. So there was a case 3. It was a case of scar endometriosis. So it is again a very painful situation where a endometriotic lesion comes up on a scar of cesareans. So it is also something which is difficult to treat, because even if you undergo surgery for it, in the newer scar again a lesion forms, which sometimes is bigger than the previous one. So in this case also, we did some treatment. We have a ultrasound. So in scar endo cases, we also do this leech therapy. So locally, we apply these leeches on the lesion area, and even a single application of these leeches gives a huge pain relief. I have done it in many cases by now, in scar endometriosis cases. So there was a report before and there's a report after. And the size of the lesion is reduced significantly along with a complete remission of all her pain symptoms. And then a few more befores and afters. A complete, the cyst is absolutely not there in the second scan. This was a case of mine from, I think from USA. So even those people who were doing ultrasound were amazed, and they have written that the cyst, which they told that it could not be removed, it is modestly decreased in size compared to the prior MRI, which was done on in 2022. Few testimonials given by the patients. So never lose hope. If you suffer, if you are struggling, give Ayurveda a chance. Thank you so much.
Thank you, ma'am. Thank you so much for your outstanding contribution to this webinar. So without further delay, let's proceed to take some questions from our participants. So
Yes.
First question, Pushpa Mahanta from Hyderabad. Therapy for pain management in Ayurveda, whether it is effective or not, and how many sessions will be required for pain relief and cost.
Okay, so I think if she would see the lecture, she would be able to understand the whole concept of pain relief in Ayurveda. Because in Ayurveda, we are not giving painkillers. We are sometimes, if a patient comes to us in a severe pain, we slowly, remove those painkillers from her regime. There is nothing which can immediately stop the pain, but I can definitely assure that if you are following the Ayurvedic treatment properly, within a month or two of the cycle, the pain starts regressing. Because whatever regression happens, it happens permanently. There is no suppression that once you pop up a pill and then the pain goes and comes up again. The pain slowly goes away because Ayurveda is working on the root cause of endometriosis. So that is how the Ayurvedic treatment goes for pain relief.
Second, Priyanka Shinde from Pune. Blotting, period pain, swelling every day. Therapy for all these things. Same
Question, I think.
Yeah, same question. And Divya, treatment for infertility.
Yes, definitely. So this is really important because as we discussed, while a female is having endometriosis, slowly the ovarian function or the tubal function, or sometimes if the endometriosis is present in the uterus, which is called adenomyosis, can lead to infertility issues. So while reversing the pathology, the chances of getting fertility back with the improvement of ovarian function, with the regression of the cyst, it is really helpful. But then, as I told that every case is different, we have to exactly figure out where the problem is present. If the ovarian function is compromised, the treatment method would be a little different. If the tubes sometimes are blocked because of the adhesions formed, the treatment will be different. And for the uterine endometriosis, if it is affecting the fertility, the treatment might differ. So according to that particular case, we can easily understand and help to regain the fertility.
And next, Pushpa from Haldwani. Experience unbearable pain during my periods. Stay in bed for 5 days. During periods, thigh pain, vomiting, feel like dying, painkiller don't work, and have to be hospitalized to receive painkillers through a drip. My EMH level is 0.50. I have been married for 7 years, tried allopathy surgery, homeopathy, Ayurveda, IVF, and I have done everything, still no baby, and undergoing Ayurvedic treatment for post 7 months from Asha Ayurveda Delhi, and since then my periods have not been regular. They come every 2 or 3 months. It has been revealed through a Doppler test that there is very low blood flow in uterus, and currently only 3 or 4 follicles are remaining. She wants to conceive.
So too much to to answer.
Yeah.
But again, I would say that definitely the endometriotic symptoms of pain and whatever symptoms you have can be relieved. But you have to undergo a proper treatment, which will include medicines and some Panchkarma therapies. Regarding the AMH thing, I would like to emphasize that nowadays it becomes a lot of thing, that AMH is low. So AMH is a anti-Mullerian hormone, is a marker which shows your ovarian reserve. So even having a 0.5 AMH is not a big deal, because even if the ovarian reserve is less, the quality of ova, the quality of egg can be improved. And you need only one ovum to conceive. So it is not exactly of that much importance as it is being given. It is important if you are undergoing IVF, because they have to retrieve a lot of follicles from your ovaries, but it is not that important. So don't get disheartened. With that AMH also you can conceive, but then with the detailed, maybe a consultation or something, individually I can analyze better if, what are the different obstructions of yours to get pregnant.
Okay. And Sangeeta Tiwari, I found in my ultrasound report left side pelvic endometriosis. It is curable from Ayurvedic treatment.
Yes, as I told you, it is very much curable with Ayurvedic treatment. After a certain stage of grade 3 or grade 4, when a lot of adhesions are being formed, that means when the tissue starts, getting adhered to each other, sometimes it is difficult to reverse. But even then, the basic inflammatory progression can be definitely, healed and cured with Ayurvedic treatments. So there are good chances. In Ayurvedic treatment, I would say the success rate is almost 80 to 90% in endometriosis, which is significantly high.
Take some question from our comment box.
So I can see in the chat box.
Gargi Kalra, if I have prolonged periods of 15 days, then how many rest days should I take from weightlifting workouts?
So if you have prolonged periods of 15 days, that is too much. So I think first you have to treat it. Getting that prolonged period is not something which is normal. And yes, those heavy period days, you should avoid doing weightlifting and workouts. If there are certain days where you have a very mild spotting, you can do some mild exercises. But I would suggest that when a uterus is bleeding, doing a lot of weightlifting or workouts can lead to imbalances. So you should first treat your prolonged periods and then avoid doing heavy workouts during your period days.
Cyst, what to do?
Sorry?
Hemorrhagic cyst, what to do?
Yes. So hemorrhagic cyst is something, if you undergo ultrasound and your ultrasonologist writes that you have a hemorrhagic cyst. So there are two kinds of cyst which looks very similar in the ultrasound, which one is hemorrhagic cyst and another is endometriotic cyst. Small hemorrhagic cysts sometimes are functional cysts. So if you have a small cyst and no significant symptoms, I would suggest that you undergo a repeated ultrasound in the next cycle. If it resolves by itself, you have to do nothing because it is something which is functional. If you again see the same size of cyst and you start seeing certain symptoms, then the hemorrhagic cyst can be a endometriotic cyst as well, and it needs to be treated.
Karti, what is the approx cost of Panchkarma Ayurveda treatment?
So, like if you ask for a Basti treatment cost, for example, for 8 days of Basti, approximate cost will be around 12,000 rupees for a package of 8 Bastis, which is usually given at a one go. Sometimes this Basti treatment is repeated every 3 to 4 months, and the treatment cost will be repeated. In some very severe cases, we do 16 Bastis instead of 8 Bastis. So there might be certain variations, but the approximate cost of 8 Bastis is approximately 12,000 at our clinic.
I think that's all. And thank you, ma'am. Thank you so much.
Yeah.
For gracing us with your presence. Thank you, ma'am.
Okay, Diksha. Thank you so
Thank
much.
you.
Bye.